Hello, my name is Dr. Grande. I want to welcome to this video on a challenging supervision scenario. I'd like to remind you that the person you'll see in this video playing the role of the supervisee is acting, and this is a completely fictitious situation that we're acting out. And also, this video is completely for educational purposes. I want to offer special thanks to two of my graduate assistants, Andrew and Nell, for their diligence and hard work in producing this video. I hope it's helpful to you, and thank you. Hi Jeff, how you been?
Alright, Dr. Grande. But I have, I don't know, I have something that I guess I should talk about, but it's, I don't know, it's kind of embarrassing. Really.
It's an embarrassing issue?
Mm-hmm. I've been working with this client named Shannon, and like it's going really well. We're making a lot of really good progress, but I've noticed that like I've started maybe thinking about her a lot, like more than my other clients. Like sometimes I even think about her when I'm with other clients, and like times when I go home. And I think like I really think that I might be starting to have like more feelings for her than I should.
Do you find that when she misses appointments, you're disappointed?
Yeah, actually, because I mean, she's like one of my favorite clients. You know,
Mm-hmm.
When she comes in, it just makes like my day a little bit better. It's something I look forward to, and then I don't know, when she doesn't show up, it kind of like depresses me for the rest of the day.
All right. What you're going through, you're attracted to this client, right? I mean, that's what's happening, and what you're going through is normal, and we're going to take some steps to make sure that everyone's protected in this and it doesn't go any further. But I want to let you know at the onset that I'm really glad you brought this to me. It takes a lot of courage. I'm glad that you have that kind of trust in the supervisor relationship. And I'm going to support you through this, and we're going to do our best to get through this okay. All right, does that make sense?
Mm-hmm.
Let me ask you a question. Does Shannon, the client, realize that you might have some feelings for her?
I mean, I don't think so. I kind of like she's going through a lot right now with her boyfriend, and she's kind of, I mean, obviously she's confided in me. She feels very safe around me, and I didn't want to tell her and kind of throw that on her either. Like I wish she knew though. Like I really wish she knew how I felt, but I didn't want to give that extra pressure to her.
Right. So you seem fairly sure that she's not aware.
Yeah.
Okay. So I can kind of see in a way how this happened. I mean, you have a trusting relationship. She's revealing a lot of personal information, so you feel closer, right? And it's not difficult to let those thoughts and feelings of attraction kind of occupy part of your day. Right, that's what seems to be happening.
Mm-hmm.
I want to explore some of the ethical and other consequences of this, right? And I realize you're not saying you're going to act on it. I mean, you've talked about your thoughts and feelings, and of course you understand those are distinct from behaviors.
Right.
But I do feel compelled to remind you that, of course, any type of romantic relationship with a client or friends of a client or relatives of a client is prohibited, right? And there are other consequences as well. Like, for example, for you, I want to make sure you're able to get your license, which likely would not happen if you had a relationship, right?
Mm-hmm.
And there's also criminal and civil penalties, like lawsuits and criminal charges that oftentimes accompany any type of counselor-client romantic relationship. All right, does that make sense?
It does, but I mean, what about like, isn't there? I remember learning about like the 2-year rule, right? So if she's not my client after 2 years, like then I can reconnect with her, right? And then I wouldn't have to worry about like.
So you're saying if I reassigned her, you wait 2 years, then you could have a relationship with her.
Well, I mean, I'm kind of stuck because I don't want to reassign her either. I feel like we're making a lot of good progress, and I'd hate to just kind of drop her because I really think I can help her.
Yeah, so you're conflicted.
Mm-hmm.
Well, let me give you my thoughts on the 2-year ban on any type of romantic relationship. That's the MBCC ethics, right, which we follow. And we also follow the ACA Code of Ethics, which is a 5-year. And whenever the Code of Ethics, whenever you have a difference in the ethics, we go by the one that's more conservative, right, that's more strict. In this case, it would be a 5-year. Right? Also, if you look at the way the Code of Ethics are written, it's more like, I think of a situation where you're counseling somebody and you're not attracted to them, and then like 8 years down the road, you run into them at a singles bar, right? And whatever their problem was is resolved, and you've seen hundreds of clients since, and you kind of connect, and then you have to decide whether there's harm that could come. So even that year, even 8 years later or 50 years later, you have to decide if there's harm that will come to that client, and then document that before a relationship can progress.
Right.
So it can't be anything planned, I guess is what I'm getting at. I don't think the intent of the rule is for you to stop seeing a client and then 5 years later on the button begin a relationship.
Right.
Plus feelings and thoughts will change drastically in 6 months, much less 5 years. Right? But I can see you're conflicted about this. I see there's a part of you that really wants to explore this attraction. But it's important to recognize that it can't happen.
Yeah, it's just kind of, I don't know, that's hard to swallow.
Yeah, it's tough because you have strong feelings. But you've brought those to my attention. You're willing to work through it in supervision. That shows great promise. I am going to reassign Shannon, okay, in this particular case, because I feel like you've kind of fallen for her, and I just want to err on the side of caution. It's no reflection on you as a counselor. All right, I'm still supportive of you. We're going to work through this. One thing that I've noticed has really helped with this particular type of situation is when a supervisee or a counselor gets counseling themselves. You kind of work through some of those strong feelings and thoughts. Would you be willing to do that?
I mean, yeah, I guess so, because this is really something that I should work through. Like, I do care about her a lot, but I mean, I also, like, I want to get my license, like you said before, and I don't want criminal charges. I'm not a criminal. Like, I don't want that. And I mean, I guess at the end of the day, really, if I did care about her, like, I want to do what's best for her, you know. So I guess if that's the best way to go.
Yeah, it is best for her. Even if you took the consequences to you out of it, which of course we can't do because they do exist, a lot of harm comes to clients that have been involved in counselor-client romances. Difficulty establishing trust, and even the chances of suicide are increased. And I know you don't want that for Shannon. So good, I'm going to allow you to find a counselor on your own, a licensed counselor. If you have any trouble finding somebody, I can refer you to somebody. Right? And now I want to meet with you tomorrow. All right, so we're going to be a little more frequently, and just so we can get through this kind of what I hope is a bump in the road, and we're going to try to keep things moving forward.
Right. Again,
I really appreciate your courage bringing this to me. It shows that you're really committed to this field and you're really aware of your feelings. Right. So does that sound like a good plan?
Yeah, I think I can do that.
Okay. And I'll see you tomorrow. Okay.
All right, thank you.
Thank you for watching this video on a challenging counseling supervision case scenario. I would like to thank Andrew and Nell again for their superb work in the production of these videos. And as always, if you have any questions or concerns, feel free to contact me. I'll be happy to help you. Thanks.